Well, okay, so it's just congenital. The uterus, normally when you're just a fetus, is going to have two horns. It'll look like that. It won't look like that. Two horns. And then as you develop, these horns fuse together. Now, many animals, cows, rabbits, most animals have two horns. With the human, it's turned into just one uterus. They've sort of merged together. Now, frankly, it's not a problem if your fallopian tubes aren't blocked. It's just fine because each one of those uterine horns works just fine. So I don't find that unicornuate uterus is a cause of infertility. But if you are infertile and say you need IVF and they discover with ultrasound that you have a bicornuate uterus, I wouldn't worry about it. Just transfer the embryo into one of those two horns of the uterus and you'll do fine. Another version of that is unicornuate, and that's where you only have one horn. This horn is gone completely. And the unicornuate uterus also works fine. We wouldn't put in more than one embryo to make sure the uterus can manage that and enlarge, but bicornuate uterus is a problem. Now, they sometimes make a misdiagnosis. If it's not bicornuate, but it looks bicornuate superficially, it could be a septum. There could be two different uterine cavities, but they never really quite merged. And there's this wall in between those two cavities. And that has to be operated on and fixed so you have only one cavity. Because if it's a septum, then it can cause miscarriage. So to make sure the diagnosis is accurate and correct, that it's bicornuate rather than septum.